Good day. Hello and welcome to JAMA Health Forum Conversations. I'm Dr. Sandro Galea. I serve as Dean of the School of Public Health at Washington University in St. Louis. I also serve as Editor-in-Chief of JAMA Health Forum, a peer-reviewed open-access online journal focusing on health policy, healthcare systems, and population health, one of 12 specialty journals in the JAMA network. In the past decade, mental health has become an increasingly central issue in the U.S. About 1 in 5 adults in America live with a mental health condition. In 2023, approximately 32% of adults in this country reported symptoms of depression and anxiety. Depression risk tripled during the pandemic years, and while telemedicine and other mental health resources have become more available, fewer than half of those dealing with a mental illness in 2021 were able to access necessary care in a timely manner. As with physical health, mental health is shaped by context. Social policy, technology and culture, economic assets like income and wealth, and other structural factors are inextricable from the mental health of populations. Changes at the level of national policy can help change context around mental health to reduce rates of mental illness and help ensure that those who need help can get it. Here today to discuss mental health in the U.S., the challenges therein, and how national policy can support better mental health in the U.S. is Dr. Ruth Shim. Dr. Shim is the Luke and Grace Kim Professor in Cultural Psychiatry and Professor of Clinical Psychiatry in the Department of Psychiatry and Behavioral Sciences at the University of California, Davis. Dr. Shim's research focuses on mental health disparities and inequities. She serves on the editorial boards of JAMA Psychiatry, Psychiatric Services, and American Psychiatric Publishing. She is co-editor of the books The Social Determinants of Mental Health and Social Injustice and Mental Health. She serves as an at-large member of National Academy of Sciences, Engineering and Medicine Forum, and Mental Health and Substance Use Disorders. I'm really delighted to be speaking with Dr. Shim today. Ruth, welcome.
Thank you. It's great to be here.
So let's start with a high-level question. Can you talk us through your perspective on the current state of mental health in the country today? What are the most pressing mental health issues that we face?
So, unfortunately, the current state of mental health in the U.S. is just not that great right now. You already shared some statistics that paint the picture, but it might even be a little bit worse than that. Because people require connection in order to be mentally healthy, we're actually seeing a lot of breakdowns in that connection everywhere in society today. Some of those breakdowns in connection are fueled by technology, others by politics, but this fraying of connections is leading to worsening mental health for everyone, especially young people and older adults. And worse, because of the way our mental health care system has been designed, when people need to seek treatment for mental health conditions, it's often quite difficult for a number of reasons for them to easily or quickly access quality mental health care treatment, as we saw in stark detail during the COVID pandemic. So there's actually a lot that needs to be reformed. There's a lot of work that we need to do, and it's a big undertaking that we have to move forward with.
Can you talk us through why we talk about social determinants, how we think about social injustice, and how they affect and shape mental health?
In my opinion, the social determinants and social justice is really how we got to where we are and how we got to this point where things are so bad as it relates to mental health. I believe they're foundational to everything. So social injustice drives the social determinants of mental health. And our opinions, our social norms about who in our society has value and who is worthy of advantages in our society and who is less worthy of those advantages, that leads us to collectively pass laws and create policies that serve to advantage some people and disadvantage others. And so what ends up happening is this disadvantage and advantage leads to unequal distribution of opportunity in our society. So that's social injustice, and that creates the context for the development of social determinants of mental health. And so where people live, the neighborhoods they live in, whether they experience trauma in childhood, whether or not they're exposed to violence, whether or not they live in poverty, whether they have access to healthy foods or clean air or water, all of these social determinants were created by social injustice. And those social determinants then set the foundation for mental wellness or the foundation for mental illness, because they create the context for the development of risk factors for mental illness, which then actually lead to the disease.
Let's talk about one particular social determinant, stigma. We talk about stigma quite a bit when we think about mental health in the academic space. Talk us through the influence of stigma on mental health and where policy can play a role in reducing stigma.
So stigma is actually complicated to unpack, but it does go back to those social norms I was mentioning. So in general, our social norms about people with mental illness are pretty terrible. We collectively have a lot of fear about people that we don't understand, and we don't understand a lot of things as it relates to mental illness. So we have these very negative beliefs about people with mental illnesses, things like they're dangerous, they're violent, somehow they did something to bring on their health problems, whether it be spiritual failings or other weaknesses. But all of those things could be categorized as social stigma. And so after centuries of this social stigma or this societal stigma, it's quite common for people to then turn those negative beliefs that society has about them inward. And that is known as self-stigma. So that's the stigma that I think we sometimes erroneously focus on too much, especially when we're thinking about why people don't seek mental health treatment. And often when we think specifically about minoritized populations and why they don't seek mental health treatment, we talk about the self-stigma that they have, and they're embarrassed about having a mental health problem, and they just don't want to seek care. But I actually think that's putting the blame in the wrong place, because I think societal stigma is actually what drives our poorly designed mental health care system, which from the beginning was set up to be carved out from the general healthcare system. And because we have such negative social norms or societal stigma about people with mental illness and substance use disorders, those public policies we created led to a separate and decidedly unequal mental health care system, which often criminalizes mental illness and lacks compassion and humanity in the way that care is delivered. It's directly connected to policy because stigma is actually what leads to the policies that have created a fragmented and broken mental health care system that we have. So if we were to think about policy solutions, we would want to redesign the mental health care system to prioritize things like access, affordability, accountability, and compassionate, high-quality care. And then if people could more easily engage in a system like that, I think self-stigma would improve dramatically because recovery would be more attainable for everyone and more people would be more open to the idea of seeking treatment if it was the type of treatment that could lead to better outcomes.
Can you talk us through some effective strategies for integrating mental health services into primary care? And with that, can you talk also about the role of early intervention and prevention in mental health care in particular?
Yeah, I think one of the reasons that integrating mental health services into primary care has been such an effective strategy is because it attempts to address that broken system. It attempts to reconnect mental health care to the general healthcare system rather than that separate and unequal system that we currently have. And so a lot of places who have started to integrate depression care into primary care settings in particular, so there's integrated care, but where we've done really well has to do with the integration of depression care into primary care. And so we have really great models where primary care doctors are able to identify depression and successfully treat depression. And so we've seen great outcomes there. But for a lot of other mental health conditions, it's not necessarily as straightforward because some conditions are more challenging to treat. And some conditions really do require much more of a specialist intervention than what a primary care physician or provider can offer. So for example, when we're talking about early intervention and prevention, great progress has been made around the treatment of psychosis with early interventions. I even work in an early psychosis treatment program. And if you catch psychotic symptoms early on, usually within the first year that people start having symptoms, and you provide an intensive model, which is known as coordinated specialty care, that's a combination of treatments that is really effective, and it's a really effective early intervention program, but it's also very time intensive, and it's also very workforce intensive. And so you have these better outcomes that are better than usual care for schizophrenia, but it requires a lot of upfront investment in order to see those early intervention programs have the outcomes that we're looking for. And since half of all mental health problems manifest by age 14 and 3/4 by age 24, we really need to be more focused on prevention and early intervention to prevent a lifetime of disability and early mortality that we currently see as it relates to mental health conditions.
We've seen this enormous rise in telehealth for mental health services, particularly around COVID, obviously, and a lot of that has stayed. Can you talk us through this, the challenges, the advantages?
Yeah, I can speak to my personal experience taking care of patients using telehealth. In some ways, it's really transformed mental health care, and it's allowed patients to access services with much greater convenience. So several of my patients do their appointments with me in their car on their lunch break from work. In the past, they would have to leave work or plan around or get a doctor's note in order to go to their appointments. It was very disruptive and very inconvenient for them. And so for those people, telehealth has been a game changer because when folks are doing really well, telehealth can unlock a greater ability for them to maintain their recovery. But I also always try to approach improvements in outcomes with a special emphasis on those populations that are most oppressed and marginalized. And not everyone has the technology that is needed to be successful to conduct a telehealth appointment. And I also have noticed personally, I mentioned before that connection with people is one of the most important things to promoting positive mental health. And telehealth does create some barriers to connection. So for some patients, it's not a major challenge, but for others, it really does interfere with the therapeutic alliance. And oddly enough, I've noticed that my younger patients who are most used to technology are often the ones that are most opposed to telehealth services and would rather come in person for their appointments, which is strange.
Let me go back to mental health of the larger picture. Talk us through some approaches to mental health care that you believe should be implemented at the national level, and talk us through what national policy we need to better support mental health needs, and in particular of marginalized populations.
It's always so complicated to think about this as it relates to mental health care, but if I were to just swing for the fences and pick the grandest idea, I would recommend a universal healthcare system in which mental health care was fully equitable with general or physical healthcare services. And I think that could transform mental health care in this country. That's not the current structure, of course. And one of the challenges we have that people bring up all the time relates to the workforce, specifically as we talk about physicians, specialty physicians in the United States. Psychiatrists are the least likely to accept private insurance, which means that almost half of all psychiatrists that practice in the United States only accept cash payment for treatment, meaning that a huge swath of the population does not have the income appropriate to be able to see a psychiatrist. So we've basically manufactured a workforce shortage that was created by low and inequitable reimbursement rates and this private-public mix of healthcare that's really led to these problems. So insurance reform, and particularly universal healthcare, could lead to a massive transformation in allowing everyone, but in particular, marginalized populations, to be able to better access high-quality and compassionate care.
What particular foci do you think we would need to better support mental health needs of children and adolescents, particularly as we look at the growing burden of mental health challenges in that group?
We talk a lot about the problem with mental health with children and adolescents, but there's not a lot of attention to how to fix this issue. I think it goes back to social norms. It's nice to say that we care about children, but our actions don't necessarily reflect this all the time. So we could make better inroads here if we thought about a national plan to address child and adolescent mental health. Again, because mental health problems start in childhood and adolescence, it's really key for us to be planning interventions at that early age and planning ways to build and promote mental wellness. And so that involves interventions and policies that prioritize the social determinants of health. And so making sure children are less likely to experience adverse childhood experiences and making sure that they are able to grow up in safe environments. But that also means then that we have to think about making sure that parents and caregivers of children and adolescents have the resources and the supports that they need so that they can create these safe and secure environments for children to grow up in.
What's the role of schools and educational institutions if we are talking about mental health, in particular, mental health of children and adolescents?
I've been thinking about this for a while, most recently, because schools are where young people spend most of their time. And one of the things I don't think we've thought about as much, and we may need to focus on a little bit more, is that schools, people talk about how schools and educational systems need to center equity and they need to be places where they practice trauma-informed care and trauma-informed educational practices for their students. But there's not as much focus on the idea that schools can actually be a source of trauma and harm to students. They can be places where, if we're not careful, we can actually be creating harm or causing harm to people. And so part of the work involves designing educational spaces that promote educational well-being, removing some of the punitive ways that we think about teaching and education, and really replacing that with building equity-centered, trauma-informed education. That would make a big difference, but we also need to screen for mental health issues in schools more routinely, and we need to be focused on that early intervention in school settings, in addition to making sure school settings are safe and secure places.
And to talk about another sector, what role do you think community-based organizations play?
I also think that community-based organizations are critical because in what I consider to be a very broken mental health care system across the country, these community-based organizations have been doing the work where these national and local policies have failed to provide appropriate care. And they often do this work, take care of people with mental health and substance use problems, with minimal resources, and they're often more attuned to the needs of the communities that they served, and so are really better skilled at taking care of marginalized and minoritized populations. So I strongly advocate for these organizations to receive more funding, more resources, so that they can provide these crucial services because they're trusted providers. The healthcare system itself has done a lot to promote mistrust, but community organizations really are of the people and by the people, and we need to do better at resourcing them so that they can do the good work that they do.
So what are the areas of research that you think are both most needed and most promising in mental health?
There have been all these amazing advancements in the treatment of mental health over the years. A lot of people right now are talking about how great the advancements are around neurostimulation therapies, psychedelics research. This is all very exciting. Our treatments in general are just getting more precise and more effective. A lot of talk about precision medicine and psychiatry. But with this progress, there hasn't been the appropriate level of focus on mental health inequities. And there hasn't been a focus on the driving factors behind inequities. So we have these improvements in treatment, but it also means that we may start to face a widening of the gap between populations of who recovers and who still can access or afford these promising and effective treatments. So I think one of the areas we really need to make sure we continue to research strongly has to do with policies that impact the social determinants of mental health and policies that promote how people can access care better.
My last question. So what gives you hope in the moment?
So it's really easy to be hopeless right now, but I am truly inspired and encouraged by the students and the trainees that I work with at UC Davis. For all of the gloom and doom that we've talked about here today, we have resident physicians that are going into psychiatry that are 100% committed to mental health equity, and they chose psychiatry because of this commitment, wanting to work directly with marginalized populations. So they want to work with populations that typically haven't been focused on or addressed before, but they're also committed to transforming the mental health care system in this country and leading in that transformation. So I'm really hopeful, and I truly believe that they're going to be successful in this work.
Well, that's a terrific way to end. I'm Sandro Galea. I've been talking to Dr. Ruth Shim, and we've been talking about mental health in this moment and how national policy can help shape better mental health in the US. Thank you, Ruth.
Thank you, Sandro.
This episode was produced by Shelley Steffens at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com, jamahealthforum.com, or look for JAMA Network wherever you get your podcasts. Everybody, thank you for everything you do. Thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.